Okay, prior to getting my medication, I would have done a focus assessment on my patient. Verified if they had any allergies, and then I would have taken vital signs. And in this case, I'm going to be giving morphine, so I would have asked the patient for their pain on a scale of 1 to 10. What was their pain? So now I'm going to go to the med room, and now I'm in the med room, and I'm going to get my medication. I have an order for morphine, 4 milligrams IV push now, and on hand I have morphine 5 milligrams per milliliter. So the total amount that I'm going to be giving is 0.8 mLs of morphine. And then I'm going to be diluting it with normal saline, and I'm using 5.2 mLs of this so that I can get to a total of 6 mLs. And that's what I'm going to be drawing up inside my syringe. And I'm going to be pushing that over 4 minutes. So pushing 6 mLs over, I'm sorry, I'm going to be pushing that, 4 minutes, and I'm going to do it in 30-second increments. So that would be a total of 0.75 mLs every 30 seconds. That's how I'm going to push it. So I'm going to go ahead and get started. Oh, I don't need these yet. So I have 10 ml syringe and my 18 gauge needle. I have my alcohol. I'm going to go ahead and clean these. Okay. So I need to, this would be in a package and it would be all aseptic. I'm going to go ahead and connect that. And then I'm gonna put air in my saline first and then in my medication. So for my diluent, I'm taking 5.2 mLs. So I need to draw up 5.2 mLs of air. I'm gonna go ahead and put the air in there. Then for my medication, it's 0.8 mLs, so that's how much air I'm going to draw up. Okay, now I'm going to take my medication. Making a little bit. I need to draw up 0.8 mLs of this. And I need a lot of resistance. And I don't think in real life that would happen, just because these have been used a lot. Okay, so I'm going to push back a little. There. A little bit more to get the air out. There we go. Okay, so now I got 0.8. Okay, so now I'm going to go ahead and draw up my saline, and now I'm going to draw to the 6 mLs, making sure not to overdraw or push any medicine back in to the saline. It's really hard. That's a lot of resistance.
So now I'm going to put a mask on myself, and I'm going to put gloves on.
All right. Okay. Almost. There's a lot of resistance because these have been used. Okay, I got the 6 mLs. Okay, so I'm going to go ahead and recap that. I'm going to label my medication with my initials, date, time, and the medication is 4 milligrams of morphine in 6 milligrams. So that's the total that I have in here. And my initials, date, and time. And I would take with me to the patient's room 3 of my normal salines. I'm gonna take my alcohol swabs. I have gloves, my medication to scan, and my actual medication. So go to the patient's room, knock knock,
I will grab.
hand hygiene. Hi, Mr. Smith, I'm gonna be administering some medication for you today. This is pain medication. Can you verify your first and last name, date of birth? Do you have any allergies to medication? Okay, good. And this is a pain medication, so can you tell me on a scale of 1 to 10, what is your pain?
10.
Okay, and where is the pain?
My back.
Okay. All right, so we're gonna go ahead and assess the IV site. Let me get my gloves on. And I would scan my medication into the MAR, and I would have done my 2 checks in the med room, and then I would do my 3rd check at the bedside. Okay. All right, so I'm gonna assess the IV. If there was a a pump going, I would clamp it, pause the pump. In this case, we have a saline lock. So I would assess the IV site, make sure there's no phlebitis, no inflammation. It's not cold to the touch. It looks good. So I want to verify patency. So I'm going to go ahead and clean this. I'm going to scrub the hub for 15 seconds.
So opening my eye, I'm dropping it in my sterile field, so it's already there.
Okay.
And I will give it
And I'm going to take my saline flush
along with my
and make sure this is open. I'm going to gently pull back to see if I get blood return. I can see it's coming back. So I would dispose of that. Clean this, scrub the hub for 15 seconds.
Oh my goodness.
Okay, now I'm going to get my next flush. I'm going to go ahead and flush the IV with 3 to 5 mLs just to make sure the IV is patent, and I'm going to watch for any infiltration. Okay, that's 3 mLs. It looks good. I don't see any infiltration on there, so I would part of that. Now I'm ready to administer my medication. So I'm going to scrub the hub for 15 seconds.
We run out of time. I want to do a lot of more takes on stuff.
Okay. I need to remove this. Go. Okay. Now I'm going to be pushing 0.75 mL every 30 seconds, and we're giving this over 4 minutes. So I'm going to go ahead and start.
Like sounds in the background and like crackling, but then the second
Watching the patient, making sure that they're not having any reactions.
I like to be doing like handling coding. After verifying the order, I will gather my leads from and then I'll just
You would open it first to make sure that everything's in there.
I was usually like the inside of the tank.
Okay, it's been 1 minute.
And then mask.
I'm going to continue to push.
Always. Blood and clay.
Okay. Sterile gloves are hot. And I'm going to first assess the site, make sure there's no drainage, redness, edema,
or two, depending on force.
and stuff like that. So Rita, and then I'm going to clean the site. So I'm going to activate,
We're at the 2-minute mark.
and then this will be attached to the patient. So I'm going to
Introduce yourself, hello, my name is Andre, individual voice, my name is identify yourself, provide privacy, allergies, specifically ornithine, and
then go down to, and
that's
I'm gonna let
giving
that
right
dry.
there. I think it's a heart issue because I can't go 5 stairs like a woman does.
How are you feeling, Mr. Smith? Good. You have to push this slowly just so that you don't have any reactions to the medication and we know that it's safe.
Right side down.
That's all right. For this procedure, I'm going to be laying you flat on your back. If you have any
Right onto the side.
trouble breathing,
And then
just
I'm
let me know
going
and I'll take you back. When you're ready, then
3 minutes.
apply the new pad once everything is dry.
And just be assessing the site again, making sure everything looks good.
that's a question.
Everything will be clean.
Almost done.
And I'm going to say this portion, so I can mark the date and the time that I applied the pad.
On the week that we submitted ours,
All right, that is the last of it.
So I will mark date.
Okay, how are you feeling?
Good.
Okay, so now I'm gonna go ahead and scrub the hub for 15 seconds.
So now I am going to add a new plate.
Okay, and I'm gonna get my
I will
flush. And I'm going to go ahead and flush this with 6 ml because that's how much I had in my medication, and I would be flushing it at the same rate. Air out of there.
and we are going
The
to
same
add
rate, so
the new
0.75 mLs every 30 seconds. And that's over 4 minutes.
So that is ready. Gonna remove the old plate.
Still feeling okay?
Yes.
Okay, good. Hopefully you'll be feeling the pain going away now since the medication is already in your system.
I'm going to clean up this new site. So I'm gonna go around on the tip, not inside, around the butterfly. Take this side and attach the new plate. Now, as a nurse, we're allowed to flush it, but not a student, so I would have the nurse flush the new plate. But assuming that I am the nurse, I will flush, make sure that it's clean.
Well, that's after. So.
I will document how the patient tolerated, that I had done the procedure, I cleaned out the dressing, the time, and the date that I did it. And I will make the patient comfortable,
This bowel tranquilizer comes up with it.
raise the side rail,
There's my glove.
lower the bed, then remove the mask for the patient, because now we can remove the mask.
That's about 2 minutes.
At least 30 degrees. Make sure the call light is within reach,
Usually check the site. That's what it is.
but I will make sure the call light is within reach.
Now,
And then I will do hand hygiene and leave the room. that okay? Do you have any suggestions?
Almost done.
It's fine. Thank you.
Then fine.
Getting ready to be. Okay.
Mm. That's finished. Okay, so we're gonna push the last of it. So, let me go ahead and, this is on a saving lock, just clamp it. And then take this back to the patient. If they were on a pump, we would restart the pump and unclamp it. I would document how, the medicine I gave, how much, what time, how the patient tolerated it, and, I would, document all that in the computer, and then I would make sure I come back in 15 minutes to check on my patient.